You may be absolutely sure your mouth is fine. No cavities, no tooth pain, you brush every day. So of course, there shouldn't be bad breath. Sounds logical, right? And yet this is exactly the situation many people live in. They believe everything is normal, while bad breath is still there. And the worst part is this. Most people around you will never tell you. They may step back a little, keep conversations shorter, turn their face slightly away, but very few will say it directly. So a person can live with this problem for years without even realizing it. Today, I want to show you how to tell if bad breath may be present, how to think about where it may be coming from, and why sometimes the cause is not your teeth at all. Let's start with one important distinction. Not every mouth odor is a problem. Morning breath is normal. After sleeping, saliva production is lower. Some people also breathe through the mouth at night. That dries the tissues and creates that typical morning smell. That is not what we are talking about today. The same goes for garlic, onions, or strong spices. Those are temporary food odors. What we are talking about is something different. A persistent, unpleasant odor that keeps returning. That is the one many people miss. Now, the first question is obvious. How can you tell if you have it? Because most people cannot easily smell their own breath, and there is a reason for that. When you breathe normally through your nose, you do not really detect your own mouth odor the way another person would. So here is a simple first check. Cup your hand over your mouth, breathe out, and smell immediately. It is basic, but sometimes helpful. If that does not tell you much, ask someone you trust. A spouse, a close family member, someone honest. It may feel awkward, but it is far better than guessing. Now let's talk about the most common source. 1. Teeth and gums. This is where the majority of cases begin. Not just cavities, but unhealthy gums. A lot of people think, if my teeth don't hurt, then my mouth must be healthy. Not necessarily. You can have no obvious tooth pain and still have gum inflammation. If the gums are red, swollen, tender, or bleed when you brush or floss, pay attention. Why? Because blood and inflammation inside the mouth create the perfect environment for odor-producing bacteria. And those bacteria do not just sit there quietly. They feed, they grow, and they release unpleasant compounds. That is often what people are smelling. Some people notice a little pink when they spit toothpaste out. Others avoid brushing certain areas because those spots feel sore. If that is happening regularly, do not ignore it. That is not just sensitive gums. That may be a sign that your gums need professional attention. And here is something very important. Gum problems can develop even when the teeth themselves seem fine. 2. Tonsils and the back of the throat. Now let's say your teeth are in good shape. Your gums seem okay, but the odor is still strong. Then we have to look deeper. Sometimes the source is not in the teeth at all, but in the tonsils or back of the throat. This is especially common in people who have recurring throat issues or a history of tonsil inflammation. Small white or yellowish deposits can collect in the tonsils. These are often called tonsil stones, and they can smell extremely unpleasant. Many people do not even know they have them. They just notice a foul taste, a strange smell, or the feeling that their breath never seems fresh no matter how much they brush. If your mouth seems healthy but the odor is still very strong, this is one possibility worth checking. 3. The digestive system. Now let's go one step deeper. Sometimes people describe a sour smell, a bitter taste, or a kind of odor that seems to come from lower down, not just the mouth. That can happen when stomach contents or acid move upward. In other words, reflux. When that happens, a person may notice a sour taste, frequent burping, a burning sensation, or an unpleasant odor that keeps coming back. And this is where many people get confused. They say, how can my stomach affect my breath? But if material is coming back upward even slightly, it can absolutely affect the smell coming from the mouth. So, if you have bad breath along with reflux symptoms, that matters. 4. Dry mouth and stress. This one surprises a lot of people. Sometimes the teeth are fine, the gums are okay, there is no obvious throat issue, no major digestive symptoms, and yet the odor is still there. Why? Because the mouth is too dry. Saliva does much more than people realize. It helps wash away food particles, it keeps bacteria under control, it protects the mouth naturally. When saliva drops, bacteria grow more easily. And one major reason saliva drops is stress. Chronic stress, anxiety, poor sleep, emotional overload, these can all leave the mouth drier than it should be. Some people notice it most during the day: a sticky mouth, a dry tongue, a need to sip water constantly. And when that happens, odor becomes much more likely. So yes, stress can absolutely play a role. Now, let me show you a simple home clue. If you want a rough idea whether the odor may be coming mostly from the mouth itself or from somewhere deeper, start with excellent oral cleaning. Brush thoroughly. Clean the tongue. Floss if you do that. Then rinse well. If after proper cleaning the odor quickly returns or still seems strong, that suggests the source may not be only the teeth and gums. It may be the tonsils. It may be reflux. It may be dry mouth. It may be something else that needs professional evaluation. And that brings me to the most important part. Bad breath is not just a social issue, it is often a signal. A signal that something in the mouth, throat, digestion, or body balance needs attention. So if this keeps happening, do not just cover it with gum, mints, or mouth spray. Those can hide the smell for a moment, but they do not solve the cause. Start with a dentist. That is the best first step. If the teeth and gums are not the issue, then the next step may be an ENT specialist or a doctor who can evaluate reflux, dry mouth, or other underlying causes. Because once you know the source, the solution becomes much easier. And that is the real goal. Not just fresher breath for an hour, but actually fixing what has been causing it. So if you have been wondering, if you have noticed people stepping back, if you have had that feeling something might be off, do not ignore it. Check it, trace it, and take action. Because something this common and this uncomfortable is often much more manageable once you finally understand where it is really coming from.